If you've already seen your doctor or an ear, nose, and throat physician for ringing in your ears and they told you nothing is wrong, there's a good chance you went to the wrong place first.
If you're navigating hearing loss or struggling with ringing in your ears, then you've come to the right place. The All Ears Hearing and Tinnitus podcast is your go-to source for expert insights, real stories, and cutting-edge solutions in hearing health. We'll dive into the latest advancements in hearing healthcare, explore groundbreaking treatments for tinnitus, and offer practical tips for better hearing. Here to help you tune into a world of better hearing, here's your host from Timpanogos Hearing and Tinnitus, Dr. Layne Garrett.
I'm Dr. Layne Garrett, founder of Timpanogos Hearing and Tinnitus here in northern Utah, and I've been treating tinnitus for over 20 years. The most common thing I hear from new patients is some version of that story. Months being passed around from doctor to doctor, told it's not dangerous, offered nothing useful, told just get used to it. So today I'm going to tell you exactly who you should see first for ringing ears, what each of these specialties can and can't do for you, and when the referral chain actually makes sense. The standard advice you'll find online and from most primary care physicians goes something like this. Start with your doctor, who will refer you to an ENT, who will rule out anything dangerous, and then maybe, eventually, you get sent to an audiologist. Now that chain isn't always wrong. For certain presentations of tinnitus, it's exactly right. But for the majority of people, it adds months of delay, 2 or 3 different copays, and often you end up sitting across from someone who's never had specialized tinnitus training telling you how to manage your tinnitus stress. The system is built to rule out danger. It's not built to treat your tinnitus. Those are two very different jobs. The American Academy of Otolaryngology Head and Neck Surgery Clinical Practice Guidelines, the official tinnitus guidelines published by the ear, nose, and throat physicians themselves, specifically state that a comprehensive audiological examination is appropriate for anyone dealing with tinnitus regardless of how long they've had it or their perceived hearing loss. Not after the ENT clears you, for anyone. Maybe you're thinking, I already talked to my doctor and they said I'm fine. But are you really though? Or did they spend 4 minutes on it, look in your ear with an otoscope and tell you there's no wax buildup and move on to taking your blood pressure? You walked out without a single measurement of your hearing. No hearing test, no audiogram, no tinnitus assessment, no idea of what's actually causing your tinnitus. Just reassurance that nothing's wrong structurally, which is not the same thing as knowing what's wrong functionally. And now you're into it 6 months. You still got ringing in your ears. Maybe you're sleeping worse and definitely more aware of it in quiet rooms. You started using a fan at night. You're checking the internet at 2 a.m. for answers for tinnitus. But you are told you're fine, so you're not sure whether to push further or just accept this as your life now. Well, I'm here to tell you that's not fine. That's undertreated, and the longer it stays undertreated, the harder the tinnitus becomes to ignore. Let me give you an example. I saw a patient a while back. He was in his 40s and he'd been dealing with constant high-pitched ringing for months. He'd already talked to his doctor and an ENT, and both had told him that nothing was wrong, but he had not slept a full night in months. He was using a fan, white noise machines, and sometimes leaving the TV on just to have something else to focus on. He'd stopped mentioning the tinnitus to his wife because he didn't want to keep complaining about something that nobody could fix. Nobody had measured his hearing. Nobody had assessed his tinnitus. He'd been cleared, but he hadn't been evaluated. When we did a full diagnostic workup, he had measurable high-frequency hearing loss that hadn't showed up on a regular test, and his tinnitus distress score was severe. We had a treatment plan set up for him within 1 appointment. He wasn't fine. He was undertreated. Now let me break down what each of these specialties actually brings to the table, because confusion is largely about scope of practice. Your primary care physician is a generalist. They're managing your blood pressure, your cholesterol, your diabetes, your annual wellness visits. Tinnitus is genuinely outside their expertise. The appropriate role for your primary care physician is initial screening and catching red flags that need urgent attention and making the right referral. The problem is when the referral chain stops there or goes to the wrong place for what you actually need. ENTs are surgical specialists. Their strength is identifying and treating structural, medical, and surgical problems in the ear, nose, and throat. Things like acoustic neuromas and cholesteatomas, vascular abnormalities, and chronic infections. For tinnitus patients, they're essential when red flags are present. But here's what ENTs typically cannot offer: psychoacoustic tinnitus assessment, sound therapy protocols, hearing aid fitting with tinnitus management, or any of the non-medical management strategies that research consistently shows are what help people the most with chronic tinnitus. An ENT who tells you to live with it isn't failing you because they're bad at their job. They're failing you because chronic tinnitus management is outside the ENT scope. It's just not their training. Audiologists evaluate how your auditory system is actually functioning, not just whether the structures of your ear look normal on an exam, but how your ear and brain are processing sound. A proper evaluation for tinnitus includes a comprehensive hearing test and also extended high-frequency audiometry to catch damage that regular hearing tests can miss, psychoacoustic tinnitus measurements to see what the pitch and loudness is of what you're hearing, and validated questionnaires to assess how much your tinnitus is affecting your life. From there, you build an actual treatment plan, which might include hearing aids, sound therapy, cognitive behavioral therapy-based counseling, and for significant cases, options like linear bimodal neuromodulation. That's a fundamentally different appointment than an ENT visit. And for the vast majority of tinnitus patients, it's where you get actual answers and real options. Now, and this matters, ENTs are not irrelevant. There are specific times when ENT evaluations should happen first or concurrently with the audiologist. And an audiologist with proper tinnitus training will know exactly when to send you to the ENT. For example, pulsatile tinnitus. Tinnitus that beats in sync with your heart is a vascular referral, not an audiology issue. When I see someone describing this, I verify by having them count the pulses while I count their actual heart rate. If those things match up, that's a vascular referral. Tinnitus in only one ear, especially with asymmetric hearing loss, needs imaging to rule out a vestibular schwannoma before anything else. That's an ENT referral. Sudden onset tinnitus, especially if it came on with sudden hearing loss, is a medical emergency. That needs same day or next day ENT evaluation, not a scheduled audiology appointment 2 weeks out. The American Academy of Otolaryngology guidelines are clear. Imaging is warranted for tinnitus that localizes to one ear, is pulsatile, or cases with focal neurological findings or asymmetric hearing loss. For the remaining types of tinnitus, that's bilateral, non-pulsatile, associated with gradual changes in your hearing, a comprehensive exam with an audiologist trained in tinnitus is the right specialist to visit first. The problem isn't that the referral system exists. The problem is when nobody at any step of that system actually manages the tinnitus. You get cleared medically and you get sent home. So what should actually happen when you come to an audiologist for tinnitus? Not a regular hearing test and a pamphlet. That's not a tinnitus evaluation. A proper assessment starts with a detailed history. The onset of your tinnitus. Is it unilateral or bilateral? What makes it better? What makes it worse? How's it affecting your sleep, concentration, and mood? Then a full hearing test, including extended high-frequency testing and otoacoustic emissions to look at cochlear function in the ranges that standard hearing tests often miss. Then that psychoacoustic tinnitus testing, actually measuring the pitch and loudness that you're perceiving in your tinnitus and how well external sounds can mask it. From that data, you build a treatment plan. Hearing aids if there is a hearing loss present, properly fitted with real ear measurements, sound therapy protocols, cognitive behavioral therapy-based counseling. For cases that haven't responded to conventional approaches, options like linear. And we track it. We use heart rate variability monitoring to get an objective read on nervous system response, not just asking you after treatment, how do you feel on a scale of 1 to 10? But here's the thing, not every audiologist does this. Most general hearing clinics will fit the hearing aids and stop there. If you're dealing with significant tinnitus, you want to see someone who holds the CHTM, the Certificate Holder in Tinnitus Management for the American Board of Audiology. That credential means the audiologist has gone through advanced, specialized training in tinnitus assessment and treatment. It's a meaningful differentiator. So, who should you see first for ringing ears? For most people, an audiologist with tinnitus specialization is the right first call. You'll get an actual measurement of what's happening, an actual assessment of what's driving your tinnitus, and an actual treatment plan, not reassurance, a plan. Now, if you have red flags, it's pulsatile, it's one-sided, or it came on really quickly, an ENT is the first place. And if you end up in an audiologist office first, they'll tell you that clearly and refer you without hesitation. And if your primary care doctor told you to learn to live with it, that's not a final answer. That's the beginning of the conversation, not the end. Now, drop a comment below. How long did it take you to get someone to actually have answers? I read every one of your comments, and your experience helps other people figure out what to do next. If you want a more detailed breakdown of what a comprehensive tinnitus evaluation should include, I've put that in our Learning Center. You can find a link in the description. And if you're here in Northern Utah and you've been told that there's nothing that can be done for your tinnitus, schedule an appointment in one of our clinics. You can find a link for that in the description as well.
A world of better hearing and relief from tinnitus is within reach, and we're here to help. Be sure to subscribe to the podcast right now and join us on the journey to clearer sound and a richer life. Thanks for listening to the All Ears Hearing and Tinnitus podcast with Dr. Layne Garrett. We'll see you next time.